In this video, we're going to start our tour of the digestive tract, going into a little bit more detail about the things going on and the structures assisting in each part of the digestive tract. This first video, we'll be dealing with the mouth and the esophagus. Here you're looking at both a sagittal cutaway view of the mouth and a front-on anterior view of the mouth. The mouth, we're all pretty familiar with it. It's bounded anteriorly by the lips, laterally by the cheeks, so a cheek on either side of the mouth. Superior, you have the palate, the hard palate, the bony portion, and then behind that, the muscular soft palate. And inferiorly by the tongue, this enormously muscular organ. The mouth is the site of ingestion. It's also the beginning of both mechanical and chemical digestion. You have chewing for mechanical processing, and you have digestive enzymes in saliva. The uvula is this portion of the soft palate that hangs down into the pharynx. It actually does serve a function. It keeps unchewed food from slipping into the pharynx. You should also be familiar with the term vestibule. The vestibule is the region between the lips and the gums and teeth. So, like if you blow your lips out, that space that you're filling with air is the vestibule. There's no nutrient absorption here normally, but there are some drugs that can be absorbed sublingually, so like nitroglycerin, and there are some other cardiovascular drugs that can be given in a tablet that's placed under the tongue. In order for a drug to be absorbed here, it has to be lipid soluble in order to cross the epithelium, but it also has to have some solubility in saliva because saliva is a watery solution. So a drug has to be carefully crafted in order to be used sublingually. As I mentioned, the tongue is highly muscular, and there are two types of muscles, the intrinsic muscles and the extrinsic muscles. The intrinsic muscles form sort of the surface of the tongue, and they're called intrinsic because they aren't attached to bone. They're only attached to the extrinsic muscles. And these are the muscles that allow the tongue to change shape. So like when your tongue is kind of broad and flat, or when your tongue is pointy, that's your intrinsic muscles. The extrinsic muscles are actually attached to the bones of the skull, and the extrinsic muscles allow the tongue to change position. The tongue serves a number of different purposes. It mixes food with saliva, forming a bolus. So a bolus is basically food and saliva. It's a compact, easy to swallow, and easy to swallow completely unit. The tongue also initiates swallowing by moving that bolus of food to the back of the mouth and triggering the swallowing reflex. It's attached by the lingual frenulum. That's what sort of holds the tongue in place. One other important function of the tongue is that it serves as a platform for the taste buds. The tongue is covered with papillae, the little bumps on the tongue. You have circumvallate papillae, fungiform papillae, and filiform papillae. And these papillae, they provide friction to help your tongue manipulate food. They also house the taste buds. Specifically in fungiform and circumvallate papillae, you have taste buds. You may be familiar with the idea that different regions of the tongue taste different flavors, but the reality is that all taste buds can detect all flavors, although there is some evidence that the anterior portion of the tongue is more sensitive to salty and sweet tastes, and that the posterior portion of the tongue, the papillae located back here, are more sensitive to sour and bitter tastes. There's a fifth taste as well called umami. That's the taste of cooked meat. The taste that gives MSG its appeal. That receptors for this taste tend to be located more towards the back of the tongue. You also have teeth in your mouth as well as the tongue, of course. And teeth are crucial for the first step in mechanical digestion, chewing, perhaps a little more technically known as mastication. Teeth are basically modified bone tissue. They're coated in a surface of enamel. That's what you're familiar with as the white portion of teeth. And enamel is the hardest substance in the body. It's packed with calcium phosphate crystals, hydroxyapatite, the same type of calcium phosphate crystals that you find in bone. But it's much more densely packed with calcium phosphate than bone is. So it's actually harder than bone. It can withstand about 100,000 pounds per square inch of pressure. So that it, just as a point of reference, that's about 6,800 times atmospheric pressure. So your teeth can take a lot of pressure. Enamel is about 96% inorganic and 4% organic matter. So it's really almost entirely these calcium phosphate crystals. Underneath this layer of enamel, you have the dentin. Dentin is the bulk of the tooth, and that's more bone-like. It's not quite as densely mineralized as enamel. It's only about 70% mineral, 30% organic material. Dentin is actually living tissue, and there are cell processes that extend out from the pulp cavity and that can reach into the dentin and replace it. Enamel, by contrast, can't regenerate. Enamel is generated when the tooth is formed, and then the cells that make it die. That's why it's important that you brush your teeth and take good care of that enamel. Inside the dentin, you have the pulp cavity with blood vessels and nerves running up, and then the whole tooth sits in a socket called an alveolus, plural alveoli, in your jawbone, your mandible or your maxilla. And there is a very short ligament called the periodontal ligament that holds each tooth in place. And then you have a gingival collar of soft tissue, basically your gum, that acts like a secondary anchor. Not all teeth are created equal. You have teeth of different shapes that are specialized for different functions. Incisors up here at the front of the mouth are specialized for cutting, nipping off pieces of food. Back of the incisors, you have the canines, also sometimes known as your eye teeth. These are more fang-like, and they're meant for piercing and tearing food. Your premolars, and behind them, the molars have a flatter surface specialized for grinding and crushing food. We have a set of teeth when we're young that are called the deciduous teeth. They're also sometimes called milk teeth or baby teeth. They come in between about 6 months and 2 years, individual variation in the exact timing. This image over here shows the timing of when the permanent teeth come in. Incisors, somewhere around 7 and 8 years of age. Canines and premolars, 11, 12, 13. Molars vary, including the third molars, what you may know as your wisdom teeth. They may not come in until you're in your 20s. The baby teeth are actually present below the gums at birth, but they aren't erupted yet. The basic substance of the tooth is formed by about 6 weeks after conception, and the hard tissue is formed by about 3 or 4 months of gestation. So when the deciduous teeth come in, they've actually been sitting there in the jaw for a while. They just haven't broken through the gum. And the same thing with the permanent teeth. They're actually sitting there growing in the bone below the baby teeth before they erupt and push the baby teeth out. These diagrams show you what I mean by that. Up here on top, you're looking at a skull with developing permanent teeth in here. The maxilla has been and mandible have been shaved away to show the permanent teeth in development. Starting to push the deciduous teeth, the baby teeth, out. This is an X-ray of the same thing going on. So a different patient, not the same skull, but it's showing 2 layers of teeth. You can see the permanent teeth in development here below the baby teeth. The third set of accessory structures in the mouth are the salivary glands. And salivary glands are not actually in the mouth, but they're around the mouth, and they secrete their product, saliva, into the mouth. There are paired parotid glands. So you have a large parotid gland left and right, submandibular gland, again left and right, and paired sublingual glands left and right. You also have scattered small intrinsic salivary glands throughout the oral cavity. This is a cadaver view of the salivary glands. Again, you've had the skin shaved away to show them. You have the parotid gland highlighted over here, so that's this tissue. You have the sublingual gland there, and the submandibular gland. Histologically, this is what the salivary glands look like. They're referred to as seromucous glands because they secrete both serous fluid and a mucus fluid. The serous fluid is watery. It's more watery. It's produced by the serous cells, and it's the serous cells that actually produce amylase. Amylase is a starch-digesting enzyme. So when you are chewing bread and it's becoming very, very broken down, very mushy in your mouth, that's because, in part, it's because of the action of amylase secreted by these serous cells. The mucus cells produce a more viscous, lubricating solution. It contains a protein called mucin that's a lubricating protein. So the salivary glands really get chemical digestion started as well. They're controlled primarily by parasympathetic innervation, so the resting and digesting branch of the autonomic nervous system, and release of saliva can be stimulated by either putting something in your mouth. It can also be stimulated by higher level thoughts of food or smelling food. So if you smell something appetizing, or if you are just thinking about food, you can sometimes actually literally start salivating. Saliva serves a number of different functions. First off, it cleanses the mouth. You actually have antibacterial molecules in saliva, so saliva helps limit bacterial growth in the mouth. It's important for tasting. Food needs to be dissolved into a watery solution in order for your taste buds to actually detect the molecules in that food. And if you have a deficiency in saliva production, you may find that things kind of taste funny. It also helps moisten the food, compact it down into a bolus that is easy to swallow, and of course it's the beginning of the chemical digestion. You have amylase, the enzyme that breaks down starch. You also have lingual lipase secreted by sublingual glands that begins lipid absorption. Moving out of the mouth now, we are into the pharynx. The pharynx, for the digestive system, you really only involve the oropharynx, which is the region of the pharynx behind the mouth, and the laryngopharynx, the region of the pharynx behind the larynx. The nasopharynx is not typically part of the digestive system, although it is continuous, so air moving in through your nostrils passes through the oropharynx as well on its way to the trachea. There's not a whole lot to say about what's going on in the pharynx. There's no digestion apart from what's happening thanks to saliva coming from the mouth. There's no absorption in the pharynx. It's really just kind of a way station for the initiation of swallowing and moving food down the esophagus. The esophagus is this long muscular tube that carries food from the pharynx through the thoracic cavity down to the stomach. And the stomach is nestled up under the diaphragm right at the top of the abdominal cavity. So food just kind of slips through the thoracic cavity down your esophagus. It has that four-layered structure that that you see throughout the digestive tract. The mucosa is different from what you see elsewhere. It's a stratified squamous epithelium, but it's non-keratinized. This is different from the skin. This is what the skin looks like under the microscope. This is what the esophagus looks like under the microscope. This thick layer here of dead skin cells, this is the keratin layer, the stratum corneum of the skin. The esophagus, it's moist. It doesn't need the waterproofing that the skin does. The skin, because it's continually exposed to air, if it didn't have a waterproofing layer, you'd die of dehydration. But the esophagus is constantly bathed in fluids, so it doesn't need a waterproofing layer. So the esophagus is non-keratinized. Moving outward from the mucosa, you get to the submucosa, the connective tissue underlying the mucosa. In the esophagus, the submucosa has mucus-secreting glands that basically just help moisten the surface of the esophagus and help keep food moving along smoothly. The muscularis externa is a little bit different from the rest of the digestive tract, and it's even different along the esophagus. In about the top third of the esophagus, the muscularis externa is skeletal muscle. In the middle of the esophagus, it's a mix of skeletal and smooth muscle, and it's smooth muscle only at the bottom of the esophagus. The outermost layer of the esophagus is actually adventitia. We're talking about the thoracic cavity, we're not in the abdominal cavity, so the esophagus is surrounded by a thickly fibrous adventitia. This is a gross anatomical view of the esophagus. You can see the trachea here has been cut away so that you can expose it. You can see the very muscular tube with the aorta behind it. The main function of the esophagus is just propulsion, getting food from the pharynx to the stomach. There's no absorption that happens in the esophagus. That thick stratified squamous mucosa would prevent that. There's no real digestion going on in the esophagus, at least no new digestion. The enzymes from the saliva are still active as food is moving down the esophagus, but there's nothing new added to that digestive process. So really, when we talk about what the esophagus does, it's just all about swallowing. A slightly more technical term for swallowing that you should be aware of is deglutition. Swallowing can be broken down into four phases, four kind of steps in swallowing. In the first stage, the buccal phase, this is when the tongue moves the bolus to the back of the mouth, and that triggers the swallowing reflex. So that activates muscles in the pharynx that swallow that bolus down. In the pharyngeal phase, the epiglottis closes, and that's that right there, so that the bolus is directed into the esophagus and does not go down into the trachea, which is not a good thing to happen. If food does go down into the trachea, it'll trigger a coughing reflex, and if that doesn't get it out, then you have just aspirated some food into your lungs and you may be at risk of developing aspiration pneumonia. As that bolus moves down, moves into the esophageal phase where peristalsis takes over, and remember those involuntary smooth muscle waves push the bolus down towards the stomach. And then lastly, the bolus enters the stomach. It passes through the gastroesophageal sphincter into that holding tank. Okay, so after studying this video, you should be able to talk about what the different accessory structures of the mouth do, the tongue, the teeth, and the salivary glands. You should be able to talk about the structure of teeth and the different kinds of teeth, so enamel, dentin, periodontal ligament. You should also be able to talk about the various functions of saliva. You should also be able to describe the structure of the esophagus. In particular, talk about the ways that the mucosa is different from other parts of the digestive tract, and ways that the muscularis externa is different from other parts of the digestive tract. You should also be able to talk about differences between the esophagus and the skin, that the skin being keratinized, the esophagus being non-keratinized. You should also be able to describe the process of swallowing.